We are most grateful that you stay with us here on Breakfast Daily on Channel 1 TV. And we're going to have an interesting conversation on something that is happening in Ghana in recent times. It's been here before. We don't know whether it vanished and came back again. But the conversation is going to be on Mpox. We've recorded some cases in this country, and we're going to speak to the experts, asking them what it looks like, what is going to be done about it, how people can know that, well, they have Mpox disease, among other things. In studio with me is Dr. Dennis Odai Laryea. He is Deputy Director Surveillance at the Ghana Health Service. Doc, good morning.
Good morning.
How are you doing?
Very well, and you?
I'm doing great. First of all, let's just enter into it. How many cases do we have now with Mpox in this country?
Currently, we have 8 confirmed cases. Cumulatively for this year, we have 9.
9.
Yes, we had 1 case earlier in the year,
Okay.
which was controlled, and so it didn't get out there. But this current outbreak, as of last night, we have 8
As of
new
last night?
confirmed cases.
So we keep recording the cases.
We suspect the cases. That is the essence of our surveillance system. Think of it for the disease surveillance department where I work, and for the whole health system, we have a surveillance system which is looking out for some diseases that we have prioritized because of multiple reasons, amongst which are those diseases that can occur in outbreaks. And so those are the diseases that we keep an eye on. Because diseases can sometimes look similar,
Yeah.
it is important that a laboratory test is done.
Okay.
And so that is the whole essence of our surveillance system. So we've had over 100 suspected cases, and it's out of this number that
we have
8
now,
have
8.
been confirmed
Across the country.
across the country.
So which places, say out of the 8 or 9, share with us the
So currently
regions.
it's just 2 regions.
Okay.
The Greater Accra region and the Western region.
Why the Greater Accra region? So the Greater Accra region is how many numbers?
So 4 of the current, and then the Western region also has 4.
4. Why these 2 regions?
I wish I could explain. It's still evidence we're gathering based on the cases we reported. But as I mentioned earlier on, it's something we are always on the lookout for. All the 16 regions have suspected cases. And so it means that we are looking out for it. And Mpox looks like other diseases.
Okay.
Chickenpox, for example. The names are rhyming. So
Yeah, chickenpox,
it doesn't
Mpox.
Mpox, yes. So we do have, and there's no way to tell, especially to the untrained eye, which one is chickenpox and which one is Mpox. And so that's why the laboratory testing is very important. And all these over 100 cases we've tested, only 9 so far for this year have been confirmed.
So now let's delve deeper. Maybe someone is watching for the very first time or hearing of Mpox for the first time.
Yeah.
Tell us about this disease.
Thank you. So Mpox is a disease that can be easily transmitted from a person who has the disease to another person, or a person who has the virus, I should say. It's caused by a virus, the Mpox virus. When a person is exposed, and it could be in multiple ways. So even just contact with exposed skin, direct contact, and some like to qualify it's prolonged direct contact. I don't like saying prolonged because I'm sure that your next question would be, how long is prolonged? So I like to say direct contact. So direct physical contact with anybody who has the rash, especially if it is discharging or is oozing some fluid that contains a virus. And so once the person comes into physical contact with this infected person, they can also get infected.
Oh.
If you come into contact with surfaces that this person has touched, So you remember COVID, we spoke about door handles and surfaces. If a situation like that also happens, the person could get infected.
So you use a spoon, I take the same spoon, I use
Dress, a person takes off the clothing, or you even share a sponge to bath at home or lie on the same bed. Once the discharges come into contact with those surfaces, and you also come into contact with them, you could get infected. There's a last part which I don't like talking about because it may cause panic, but it's important that people know that it can also be spread like we experienced for COVID. There's some evidence. It's not as robust evidence as the ones I've discussed earlier on, which is that you can actually get infected if you're talking face to face with a person. The virus has been found in droplets. Wow. So when a person is talking to you and is infected, a person can also get infected. The other thing, and I think I mentioned that before we got on air, that is that it can also be spread by persons who may not necessarily have the rash. And I think that is where what the WHO calls face-to-face transmission is possible.
So they could have the virus, but they don't exhibit. Nothing shows that they have it.
Or they may even be the symptoms come in stages.
Okay.
For most people, the rash is not the first thing that would come. They may get a fever, a severe headache, body pains and weakness before the rash may come.
Okay.
Some, it may just start with a rash. And so for those who may be going through these symptoms I've mentioned without the rash, they could also potentially transmit it.
Wow.
And so that is why for us in the Ghana Health Service and for all of us in the health sector, it's important that once we identify anybody who has the disease, we look out for people who may have come into contact with this person and follow them up. So that if they start developing any symptom, then we take the necessary measures. So we don't wait for them to develop the rash, which then most likely people are even likely to take precautions. Once you see somebody with the rash, and especially now that we're talking about it, people may take the precautions they need to. But otherwise, it's important that anybody who is unwell gets to the health facility. As I mentioned, the initial symptoms look like malaria and all the other infectious diseases that we can think of. So it's important people go to the hospital.
So when you identify people like that, do you do some sort of isolation, or they can still stay within other people, or they should be isolated at all costs?
So you mean the people who have come into contact?
So maybe someone has Mpox.
Yes.
You've identified that this individual has
Mpox. Yeah.
But from all what you've stated, the little contact he or she gets with another person is transmittable or communicable. The person is definitely going to get it.
That's right.
Do you isolate the affected person?
Yes. So, and even if they have to do home care, and I think we did that during COVID as well, we take them through the necessary procedures or the processes they should go through to make sure that they don't spread the disease. And so making sure that they are sleeping alone. I mentioned that if you lie on the same bed with that person, you could get infected without the person coming into physical contact with you. As much as possible, restrict usage of, household items to yourself. And people should keep their distance. And if there's any form of contact, I think hand hygiene is one of the most underrated but very effective ways of preventing infections. And so people should have sanitizers on them. We should go back to the days. If you come into contact, you shake anybody's hands or come into contact with any surface, you make sure that you use the hand sanitizer, or if the hand washing facilities are available, we can use that as well to protect ourselves.
What leads to this? Is it filth or your environment? What exactly leads to you contracting Mpox in the first place?
So it used to be a disease mostly found in animals, and before 2022, the World Health Organization has indicated that there was no documented or evidence of large-scale human-to-human transmission. So it was only in 2022 that it came up that we are seeing this large-scale human-to-human transmission, which then meant that it was now easier for one person to get it and transmit it to another person.
Okay.
And once the virus is in circulation in humans and in some animals, the risk of the infection is always there. So it is not necessarily something specific we've done, although there are, issues around our use of the environment. So coming into contact with animals who can then spread the disease to humans, and then once it gets into humans, it can easily be spread. I think I mentioned, for example, that if you're sitting in a trotro, for example, and somebody has Mpox in the trotro, or in any form of public, where there's congregation of persons, then the disease can be spread.
And you're scaring us. We can't sit in church again.
No, it's just an example.
Is that
because
example?
it's the easiest example of how we sit next to each other.
Wow.
In very close proximity. I mean, I'm sure if you go to the banquet hall,
Yes.
for example, people sit. And so all those are opportunities or risks, I should say. They are not opportunities. They are risks for the disease to be transmitted.
Wow, then we have to be very careful. Now we have 8, or let's say 9.
For this year, but in the current outbreak, we have 8
8
confirmed cases, yes.
Can it go more? Because we know in a country like Sierra Leone, they recorded about, is that
over 2,000
over
cases,
2,000.
yes.
So we could go more if it's not controlled.
It could, that's right.
How are you controlling it?
So we as a service, and I think that this opportunity to engage the population using your medium is one of the critical things we're doing. People need to understand the disease, how it's transmitted, and even when somebody gets it, what we can do to prevent ourselves from getting it. And so, as I mentioned, it's a disease that is transmitted from person to person. Physical contact, all forms of physical contact you can think about. A hug, a kiss, a handshake. Once the person has the lesions, it can be spread. And I've also mentioned that there's some evidence that it can also be transmitted when, even just standing in front of somebody who has the virus and is talking to you, it can be spread by droplets as well. And so those must be known. If you find anybody who has the symptoms, then you need to ensure that you don't get into physical contact with this person, and ensure that the person goes to the hospital as soon as possible. But generally also, if we feel unwell, our recommendation has always been that we go to the hospital. Let's not go first to the pharmacy and try to get something to take. It's something we've observed in a few of the cases we've seen. And that also means that you have potentially more contacts to follow up, because everywhere they go, there's a potential for people to have in contacts there.
Final question. Can Mpox lead to the death of someone?
Mpox does kill. It may not necessarily be the disease itself that kills. It may be complications. For example, if a person gets a pneumonia as a result, or what we call septicemia, which basically means that you have germs in your blood. The Mpox is there, but it may not cause a septicemia. But once the lesions are exposed, bacteria or other germs can enter and go into the bloodstream, and that can result in death. The only no death is acceptable from especially from outbreaks. So I'm not going to, but I'm looking at it in the context of other diseases. If you take Ebola, for example, the case fatality rate can go up to about 90%. But this one, the evidence is that it's less than 5%. Okay. In fact, in some cases, less than 1%.
1%.
So it's not a disease that would necessarily kill. But as I mentioned, it's easily transmitted. And it's also not pleasant to the eye. I mean, when the pictures you've seen. And so that is our main concern. And that's why we want everybody to take the necessary precautions to prevent all of us from getting it.
Dr. Dennis Odai Laryea, he's a deputy director for surveillance at the Ghana Health Service. He has helped us to understand this disease well, Mpox, and what we need to do as citizens or the public so we do not contract this disease. Doc, thanks so much for your time.
Thank you for
and
having
we will
me.
definitely call on you when we need more information on this.
Sure, anytime.
We are still watching